name is Ashley Shears, and this is for Assessment Item 3, Oral Presentation, Narrated PowerPoint, Foundations of Clinical Diabetes. The narrated PowerPoint will discuss basic overview and management of diabetes for adults newly diagnosed with type 2. It will be for a group of 6 adults of various ages with their significant other friends. Type 2 diabetes overview. What is type 2 diabetes? Within this narrated PowerPoint, we will discuss the definition of type 2 diabetes, risk factors associated with type 2 diabetes, signs and symptoms of type 2 diabetes, Mediterranean diet benefits for people with type 2 diabetes, pathophysiology of type 2 diabetes, principles of the management of type 2 diabetes, diabetes care team. Definition of diabetes mellitus, type 2 diabetes. The World Health Organization defines diabetes mellitus, type 2 diabetes, as a chronic disease that is caused by acquired or inherited deficiency with the production of insulin by the pancreas, or due to the ineffectiveness of the insulin produced. The deficiency of insulin results in an increased concentration of glucose within the blood, which in turn damages the body's systems, in particular the cardiovascular system, peripheral vascular system, and microvascular, macrovascular system. The two main forms of diabetes. Type 1 produces little or no insulin. Type 2 does not make enough insulin or the effectiveness of the insulin. Globally, the prevalence of type 2 diabetes continues to rise in developing countries, but has risen in developed countries now and is putting the world into economic crisis. Type 2 diabetes will be the focus of this narrated PowerPoint. Risk factors. Diabetes has been thought to prevail due to several risk factors that include poor sleep, high cholesterol levels, smoking, unhealthy eating, depression, aging, family history, physical inactivity, obesity, cardiovascular disease. You may find yourself fitting into more than one category. Non-modifiable can't be changed. Family history, genetic predisposition, ethnicity, increased age. Modifiable can be changed. Physical inactivity, obesity, sleep, smoking, environmental factors, mental health, HbA1c level, unhealthy eating. Medical, cardiovascular disease, hypertension, cholesterol levels, cerebrovascular disease, medications such as corticosteroids. Signs and symptoms. How do you feel? Feeling thirsty? Increased toilet frequency? Feeling tired? Cholesterol levels, HDL-LDL ratio, depression, recurring infections, sleep quantity and sleep quality, poor healing of wounds, feeling hungry, blurred vision. Pathophysiology of type 2 diabetes. You need insulin to process the glucose from the food you eat to give you energy. Type 2 diabetes develops when the human body does not make enough insulin or the human body does not respond to it effectively and gradually loses its ability to function. This is known as insulin resistance. It causes glucose to stay in the blood, leading to a higher than normal level of glucose within the blood system. Insulin is classified as a hormone that controls the amount of glucose within the blood system. Insulin helps glucose produced by the digestion of carbohydrate from food we eat move from the blood into the body's cells where it can be used for energy. Principles of type 2 diabetes management. How can you manage your diabetes? Monitoring of blood glucose levels, medications, physical activity can help you understand what impact foods, exercise has on your blood glucose. Diabetes education does play a major role in the management of type 2 diabetes by improved percentage of patients adhering to medication compliance and self-care performance. Limiting alcohol to less than 2 drinks daily can help with weight loss and lowering blood pressure. Healthy eating can help you manage your blood glucose levels. By reducing sugar following a Mediterranean diet has been shown to improve blood glucose levels and overall health and well-being. 30 minutes of physical activity daily can help to reduce weight and also helping your muscles with uptake of glucose for energy. Seeing your general practitioner to monitor your HbA1c blood levels, cholesterol levels, and blood pressure regularly. Principles of type 2 diabetes management. Individuals with type 2 diabetes are at high risk of developing peripheral vascular disease, cardiovascular disease, stroke, leg and foot amputations, and blindness. Monitoring for these signs and symptoms and seeking medical treatment and thus can reduce complications in the short and long term. Depression is a mood disorder and has been associated with a high risk of developing diabetes. Due to people with depression tend to not participate in physical activity, eating unhealthy foods, which leads to obesity. Principles of type 2 diabetes management. Healthy eating. The Mediterranean diet is based on unprocessed whole grains, seasonal fresh fruit, vegetables, nuts, seeds, seafood, extra virgin olive oil, herbs, spices, and poultry. The nutritional profile of antioxidants from following a Mediterranean diet has been shown to be efficient for the prevention and control of reducing blood glucose levels, blood cholesterol levels, reducing inflammation, reducing unhealthy weight, and thus reducing insulin resistance and improving overall health. Physical activity. Regular physical activity helps cells take up glucose, reducing blood glucose levels, improve cardiovascular health, helps to regulate mood and feelings, helps with body weight management, reducing insulin resistance, reducing blood pressure and blood lipids. Type 2 Diabetes Care Team, the team that cares about your health. Diabetes Educator, educate people with newly diagnosed type 2 diabetes, monitors blood glucose levels and educates patients. Diabetes Support Group, supporting people and having people talk about diabetes and how it is affecting them. General Practitioner, provides referral to diabetes educator, dietitian, dentist, podiatrist, endocrinologist, optometrist, ophthalmologist, exercise physiologist, and physiotherapist. Also orders blood tests for HbA1c, cholesterol levels, blood pressure monitoring, and monitors signs and symptoms. Dietitian educates about healthy eating habits. Pharmacist educates patients about diabetes medication, example dose, frequency, side effects, and use. Dentist, general mouth care. Podiatrist monitors feet for signs of wounds, ingrown toenails, and skin conditions. An exercise physiologist, physiotherapist, educate about exercise and exercise recommendations and injury prevention and management. Endocrinologist, specialist in diabetes care. Optometrist, ophthalmologist, education, prevention and management of eye health. Conclusion. In conclusion, effective modifications in lifestyle including diabetes education, having a diabetes care team, reducing alcohol consumption, meditation, stopping smoking, blood glucose monitoring, mental health support, adherence to medication management, reducing body weight by increasing physical activity and following a Mediterranean diet can be the goal for the prevention of people with type 2 diabetes.